Well, welcome to week 6 of culture. This week we're going to be looking at environmental control. And if you looked at the textbook, you noticed I'm going out of order. That's because time has a little less content in it. So I want to save that for next week because next week you have your activity paper due. So if you haven't already done your activity, I want to make next week a little lighter so you can do that. So this week is environmental control. You have, just like usual, a discussion board due on Wednesday before 10 p.m. and then go back and reply to 2 people in your discussion board by next Monday at 10 p.m. If you've not yet posted your presentation of your culture or religion, that is due this week. This is our last week of presentation, so that is due by Wednesday at 10 p.m. and then everybody will need to look at those and comment on 2 of them by next Monday at 10 p.m. You also have a journal due by next Monday at 10 p.m. So those are the due dates. There's a few things in the textbook that I wanted to highlight. The first one is that patients are illness motivated or focused, and we're focused on disease process. So if a patient comes in and we start telling them about the cholesterol building up in their arteries, and that's why they have to have this special diet. That's not why they came in. Their arteries don't feel anything. They came in with the symptoms they're having. If we totally ignore their symptoms, they feel like we don't care about their health, even though we understand the pathophysiology behind what's going on. We need to acknowledge what matters to the client, and that is their symptoms. So be respectful of what they're saying and what they're focusing on. And if we are respectful to them, they're much more likely to be compliant with the kind of medical advice we're giving them, especially when what we're giving them may not really address the symptoms that they care about. The next thing in the book I wanted to talk about is individualistic versus group orientation. In America, we are very individualistic. We believe everyone should have control of his or her own choices. In healthcare, that's the same thing. People should be able to choose their doctor, what healthcare they do want, and we may not be very comfortable with clients who have a different view of that. There are some people that group consensus matters far more than what they want. In fact, if you ask them what they'd want, they don't really have an answer for it because they want whatever the clan leader or their father or their husband or their community says. What they want is connection to that group, not some individual choice. And I think that can be hard for us when we have a client like that because we're so unused to that being someone's preference over making their own individual choice. So realize what we want to do is ensure that people get the health care they want, not the health care we would want if we're in their place. Another concept in the book that I wanted to bring up is locus of control. I assume you have an internal locus of control because you're here in a nursing program. So you believe that you can eat well, sleep enough, do things to lower your stress, exercise, and that's going to make your immune system at its best. You're going to wash your hands all the time, and that's going to prevent a lot of illness. There are some people who just don't see how that can help. They have an external locus of control. They feel like people get sick, there's nothing you can do. And if you try and explain it to them, they're going to tell you the story about the person they know who never went to a doctor and lived to be 90. And the other person who went to the doctor all the time, followed the doctor's advice, and died at 40. They just don't see that there's anything they can do. A client like that, it's going to be really hard to get them to take their blood pressure medicine every day or monitor and manage their diabetes because they just have this fatalistic, there's nothing I can do attitude. Those clients are very hard to deal with. And I would say generally the best thing is to try and go baby steps with them. We're not going to get somebody who has that external locus of control to suddenly be extremely compliant with diabetes management. But maybe we can get them to exercise a little and check their blood sugar a few times a week. They're not going to do it 2 or 3 times a day. So if we can be respectful rather than just telling them they're wrong and try and get them to make changes slowly, and especially getting their whole family or community, whatever, involved, usually helps too. And then the last thing, the book really talks about alternative healthcare practices, and that's the direction you'll see that I'm taking the course this week. I want to focus more on that, and that's what you're going to be posting in the discussion board. So that is what you'll be doing this week, and I'll see you in the discussion boards.